The topic of fasting is quite popular among health and fitness influencers. And yes, it is an effective tool for specific longevity and health improvement implications. But there are certain situations and groups of people for whom fasting is not just ineffective, but may also be harmful. In this video, I'd like to briefly outline these groups and situations so that we are all on the same page, and so that if you represent one of these four groups, that you don't embark on long-term fasting, which may cause harm. I'd like to note that here I'm not referring to intermittent fasting, when the point is to limit food intake to a certain time within the 24-hour period, but I'm talking rather about long-term fasting in excess of 24 hours, particularly for 3, 5, 7 days or longer. The first group for whom long-term fasting is dangerous are type 1 diabetics. In order to understand why, we need to look at what happens in the body when we go into long-term fasting. When we stop eating, we stop receiving energy with food, including in the form of carbohydrates, that is glucose ultimately. Once the existing glucose and glycogen stores have been used up, our body begins to switch to alternative fuel sources. For example, fatty acids are mobilized from the fat tissue, and liver starts producing ketone bodies from these fatty acids. And these ketone bodies are ultimately used as energy by different tissues, including brain. In individuals with normal pancreas beta cell function, the beta cells are the ones that produce insulin. As ketone body production increases, there is an activation of feedback loop from insulin. And insulin both suppresses lipolysis, which is the breakdown of fat that frees up fatty acids to subsequently use them for ketone body production. And insulin also inhibits the enzyme involved in the ketone body synthesis. So in individuals with normal insulin production, ketone body overproduction is prevented by insulin. And ketoacidosis, which is a dangerous condition that happens with too much ketone bodies around, doesn't occur. Conversely, if we think about individuals with impaired insulin production, such as persons with type 1 diabetes, insulin cannot control ketone body production because there's not enough of it around, and ketoacidosis is a real life-threatening risk. So despite the fact that type 1 diabetes is an autoimmune disease and long-term fasting is stipulated to be effective to some extent to get autoimmune diseases under control via reducing chronic inflammation, it is not a safe tool for patients with type 1 diabetes. Maybe it is possible in a medically supervised environment with insulin supply, with a ketone measurement. However, don't try that at home. The second group for whom long-term fasting is not ideal are pregnant women, including pregnant women with gestational diabetes. During pregnancy, our focus is primarily on the healthy diet that supports fetal growth. And although thinking about fine-tuning the pregnant woman's diet to avoid excessive caloric surplus, particularly if that happens from junk food intake, is reasonable, long-term water-only fasting or even significant caloric restriction may pose danger for both mother's health and fetal development, and thus are unwarranted. The third group to avoid long-term fasting are people with a history of eating disorders, such as anorexia or bulimia. In such cases, long-term fasting may pose a risk of malnutrition, and it also may pose a risk of relapse or worsening of the existing primary condition. And finally, the fourth group for whom long-term fasting is not the best tool are people with low muscle mass. Irrespective of the fat percentage, if you have high fat percentage, so you're overall overnourished and low muscled, or you're overall undernourished, so with a low fat percentage and undermuscled, regardless of that, long-term fasting is not ideal for you because you would be putting yourself at a high risk of further muscle tissue loss. And the best approach for someone with excessive fat mass and low muscle mass would be to combine caloric restriction with adequate protein intake and well-designed resistance training protocol in an attempt to reduce fat mass while preserving or even increasing muscle mass. And all this, of course, should be guided by meticulous food logging and regular DEXA checks to assess body composition, for example, every 3 months. I hope you find this video helpful, and if you do find yourself belonging to one of these 4 groups, you will consider alternative options to reach your health and longevity goals other than the long-term fasting, which is potentially harmful.